cardiovascular pharmacology, calcium channel blockers. All right, so starting out with calcium channel blockers, we need to understand which drugs are the calcium channel blockers. First, we have any drug that ends with dipine, D-I-P-I-N-E, dipine, are going to be our dihydro calcium channel blockers, okay? And they act specifically on the vascular smooth muscle, okay? And then we have our non-dihydro, non-DHP calcium channel blockers, and those are diltiazem or verapamil. Verapamil is the main one that we're going to be talking about. And those two, those non-dis, act on the heart, okay? So we have two types of calcium channel blockers. One that acts on the smooth muscle of the vasculature, which are known as the DHPs. And then we have the non-DHPs that act on the heart, okay? So all that calcium channel blockers do, they're going to block voltage-dependent L-type calcium channels, okay? And once again, depending on if you're a non-di or a di, you're going to be blocking the calcium channels in the smooth muscle or the cardiac muscle, okay? And all that this does is that it's going to decrease muscle contractility, okay? That's it. Now, the number one vascular smooth muscle DHP calcium channel blocker that you need to know is amlodipine and nifedipine, okay? The heart calcium channel blockers, the non-DHP drugs that you need to know specifically is verapamil, okay? Diltiazem is also one that's like that, but verapamil is the main one that you need to know, okay? Now, why do we use this? The reason we use this is for multiple purposes, but it can be used for hypertension or angina, as well as Raynaud's phenomenon, okay? And that is specific to our DHPs, okay? So the ones that end in dipine that act on the vascular smooth muscle. It's used for hypertension, angina, as well as Raynaud's phenomenon, okay? Now, the DHPs, they mainly dilate the arteries, right? Because of that calcium channel blockage, we're going to relax the vessels on the vascular smooth muscle, and we're going to dilate those arteries, okay? Now, let's talk about the specific drugs. First off, we have nimodipine. Nimodipine is high yield to know, and we're going to talk about it in the neuro section, but nimodipine is given to patients after they've had a subarachnoid hemorrhage because it prevents having vasospastic attacks, okay? So once a patient has a subarachnoid hemorrhage, which we'll talk about later in the neuro section, you have to prevent a cerebral vasospasm, which is deadly. So the way that we do that is we give them nimodipine, which is a type of DHP calcium channel blocker, okay? Now, for non-DHPs, how do we treat it? Same thing. We're going to treat hypertension, angina, and other things like that, okay? Now, the adverse effects of the calcium channel blockers is very important, okay? So they're going to have gingival hyperplasia, but what they love to ask is for the DHP drugs, okay, the ones that act on vascular smooth muscle, right? Since they dilate those arteries, right? They dilate that smooth muscle, you're going to have effects of peripheral edema, okay? So that's very logical. Those DHPs have increased risk of peripheral edema, and they love to ask that question, okay? And the rest of them aren't really too high yield for the adverse effects. Just make sure you know that peripheral edema.